What's really unique about Overlook and what's unique about the Carol G. Simon Cancer Center is that we really blend high touch with high tech.
There is laughter here. This center is about being positive, about hope, about humor, and about being a family.
I guess this is our 6th year now. We're very happy to service here.
The staff, as well as myself, and patients, were very much involved in creating the atmosphere in the setting.
Have you done any art therapy before?
No,
Okay.
but I like to draw.
It's a way to help someone relax and enjoy the wholeness of the moment.
Now, having cancer is not a positive experience, but under the circumstances, it is what it is. Donna and Karen and Liz and all the nurses here, they're very sensitive to my needs.
When I do my rounds and I walk through the infusion center, patients actually stop to grab my arm so they can tell me how good their care providers are. There's nothing that makes my day better.
Carol was a wife, a mother, a philanthropist, and a volunteer to our community. We've created an environment with all specialties, so it's really the entire team of both scientific medicine and complementary services that form together the unique culture we've developed here at the Carol G. Simon Cancer Center.
Another thing that we've done is we created a Caregiver Center. It started by a community member.
The Thomas Glasser Caregiver Center is the only one of its kind in the state of New Jersey, and it's made a profound difference to the families of our patients. I think it's reassuring for our oncology patients when they're coming in for outpatient treatment to know that there's a place for their family to go to be cared for. We also train some very special volunteers who are able to extend outreach into the rest of the hospital. We have pet therapy teams, and you can hear the energy change in the room when a dog arrives.
So we have all this warm and caring staff, yet we have incredibly sophisticated technology and programs. We have a high-risk breast clinic for women who have either genetic disposition or other risk factors that make them significantly at risk for breast cancer. We had the first PET CT scanner in New Jersey. We had the first CyberKnife in New Jersey, and this year we'll treat 200 patients, almost all cancer patients.
PET CT scanning combines 2 different modalities and therefore is part of what we call fusion imaging. The Journal of Clinical Oncology determined that PET CT scanning could affect the treatment of a patient up to 70% of the time.
We at Overlook are one of the very first hospitals to have the robotic technology, and more importantly, we've really gone on to be the busiest center for robotic surgery for gynecology and gynecologic oncology in the state, and even one of the busiest centers in the tri-state area. You shouldn't feel like the robot's performing the surgery. It's really just a tool that helps us to do minimally invasive or laparoscopic surgery, giving us much better fine motor control and better visualization.
The CyberKnife is a unique piece of equipment. It enables us to deliver high-dose pinpoint radiation in areas that we previously couldn't treat. This is the whole machine, and it's attached to a robot that is actually a robot that's used in automobile assembly plants. The machine then becomes mobile and can aim at tumors from more than 1,100 different angles, but enables us to give extremely pinpoint treatment in high dose and deliver it rapidly. And we all know if we can deliver the high dose rapidly, it's going to be more effective than delivering small doses on a prolonged basis.
That means a lot to a physicist to be in the institution that it's always implementing the newest and the greatest.
The reason for our participation in clinical trials is twofold. One is advancing the knowledge base in terms of how we treat patients. But more importantly, from the community standpoint, it means there's accessibility to the latest advancements in oncologic care.
All the team knows each and every patient. Well, we very much work collaboratively, and our research is involved in every aspect of the patient's care.
One of the trials that we have here at Atlantic Health is an ovarian cancer early detection protocol. We're partnering with MD Anderson Cancer Center in Houston, and we're testing normal risk women to see if we could better pick up cases of ovarian cancer at an earlier stage. We're the only site in the tri-state area who are enrolling patients in this study. Here at Overlook and Atlantic Health, we're participating in the American Cancer Society's CPS-3 study, which is a cancer prevention study 3, or the 3rd generation, looking for different risk factors that people have and how those risk factors are related to development of cancer.
Participating and educating the community about public health and how to improve their health has become a bigger part of our mission as we've moved forward and as the nature of healthcare changes.
Oncology is a tough business. It is not for the faint of heart.
You know, man needs to feel loved, and he needs to feel like his work has value. And while your work can have value apart from medicine, certainly, medicine is a very worthy calling, I think.
I tell my kids this all the time. You know, I'm a better person today than I was 25 years ago. There's a piece of Mrs. A, Mrs. B, and Mr. C that are part of me because of my experience in taking care of them.
We are very fortunate in that we have a staff here who I couldn't even begin to speak to their dedication.
So this is an opportunity to be creative about changing the healthcare paradigm. We really have this incredible set of technological offerings here in a place where you really get the human touch.